Good morning, ma'am. So, I'm your nurse Ellen po. Today po, we're going to perform po the oral hygiene po sa inyo. So, first step po is to identify the patient with two identifiers. So, ma'am, may I know your name po?
Charlene Hernandez,
Birthday po, ma'am.
March 28.
Okay po, ma'am. So, second is to assess the environment for safety. So, we can see naman po na the patient is already safe with her position cassette po. So, next po is we're going to perform hand hygiene and apply clean gloves. So, I know my hands is not contaminated at all and it was clean. So, magsa-sanitizer lang po ako and I will apply my clean gloves. So next is to instruct the patient not to bite down and inspect the lips, the teeth, and the buccal mucosa, gums, and tongue. And next step is to identify the common oral problem like singaw, ganun po, sa ating pasyente. So, I will remove now my gloves. The next step is to remove my gloves and perform another hand hygiene. After finishing the assessment, now we're going to do the planning. So, number 1 in planning is identify the expected outcomes. Number 2 is to gather the equipments and supply. And number 3 is to explain the procedure to the patient and discuss preferences regarding to the hygiene aids. Next is to assist the patient to the proper positioning. So, ma'am, dahan-dahan lang po. Assist ko po kayo. Kailangan po natin itaas. 1, 2, 3. Assist lang po, ma'am. Wait lang po. Okay po, dahan-dahan po ulit, ma'am. Dahan-dahan. So, agpa-atras po muna pala tayo, ma'am, kasi atras po kayo ng kami dito. Ayan na po. So, here's the proper positioning. So, next step is to place the towel to the patient's chest. So, we'll put the towel to the patient's chest. And next is to perform hand hygiene and apply clean gloves. Hand hygiene. Now I already have my bra and my clean gloves. Next is to Next is to place the toothpaste on the top of the basin and place some toothpaste and pour water to the brush. Next step is to allow the patient to assist you for brushing her to which side. So, ano saan niyo po gusto, ma'am? Saan po? Lang po kayo, ma'am. Wait lang po pala. Huwag muna po kayo. Close bite po, ma'am. Dito muna po tayo sa side po. Ano pa na natin dito? Huwag po kayong huwag po sana tayong magulo, ma'am, para mas mapadali po. Okay lang po ba, ma'am? Okay lang po ba kayo, ma'am? Dito naman pong side. Close niyo lang po yung bite niyo, ma'am.
Hindi agad katawa.
Hindi agad katawa niyo. Taas baba po ang motion. Close bite lang po, ma'am, para ma-ensure po natin. Dito na po sa baba. Sa taas mo.
Ano, di Dara? Gagi ka.
So next step po is to have patient to hold the brush and brush her tongue po. For her po, para hindi po siya, alam niya po yung ginagawa sa side po yung tongue po yung ano niya, para hindi po siya masuka. If ever man po na ako yung mag-brush sa tongue niya is, baka makiliti po siya, masukahan niya po ako. Okay? Okay. So, next step po is to rinse the mouth na po. So, with water. So, rinse. Isa pa po. Isa pa po ba, ma'am? Sumagot ka kasi. Wait lang. Okay, okay lang with Aji, diba? Ang i-assist na di sarili na. So, tap lang po for drying her mouth. So, next step po is the mouthwash. Maluwag mo lang, tapos i-stick mo lang. So, mouthwash. Pwede na pong idura dyan, ma'am, pag okay na po kayo. Next to is wipe the patient mouth po. So, next step po is to floss the patient. So, kaya na po bang mag-floss, ma'am? Ako na lang po mag-floss sa inyo. Kailangan, we need to instruct our patient the importance po of flossing para mag-floss po siya everyday. So, alam po kayo, ma'am? Floss pa eh. Sabay?
Stone be.
After flossing po, is we're allowed the patient to rinse again the mouth. Once more. And spit in the basin. Saba po.
Tapos next is takot ko.
Oh, yung naka-video ata. And we'll wipe the patient. After wiping her mouth po, we will apply the moisturizer. Ma'am, would you like to have some moisturizer po?
No, I'm allergic.
Okay po. Since the patient po is allergic to the moisturizer po, we're not applying some moisturizer to her lips. During scene, we will now assist the patient to from some comfortable position. So, we will now remove the towel and assist the patient. We will now put this towel to the laundry bag. Now, assist ko lang po kayo. Ulit. 1, 2, 3. Forward po tayo konti, ma'am. Sige pa po. Baba na po tayo, ma'am. So, are you comfortable na po? Okay po. So, next, after making the patient comfortable to her position, after making our patient comfortable, we will now put the side rail. Tataas na po natin. Assuming that nataas na po natin ang side rail, and to ensure na baka hindi, para ma-ensure the safety of the patient, baka malaglag po kasi. And we will now fix the paraffin, the equipments and supply na ginamit natin. And next, we will now wipe off the side table. And put it to the laundry bag. I will now remove my clean gloves and dispose it to the proper receptacle. After the implementation, we will now proceed to evaluation. So number 1 is ask the patient if any area of oral cavity feels uncomfortable or irritational. Meron po ba kayong areang irritational and uncomfortable sa mga niyo, ma'am? Wala. So next is to apply clean gloves, inspect condition of oral cavity, perform hand hygiene. Next is to observe the patient brushing and flossing. And number 4 is to ask the patient to describe the proper hand hygiene technique and recommend frequency. So, tanong natin yung patient. And number 5 is to identify unexpected outcomes. So, for recording and reporting, record procedures and need condition of oral cavity and appropriate log. Next is to report bleeding, pain, and presence of lesion to the nurse in charge or healthcare provider. So that's all for today. So thank you guys. Thank you, ma'am.